Information shaping our community. This is Moose Talks with your host, Doug Craig, on Moose FM.
Welcome to another episode of the show. Later, we're going to be joined by Dale Plourde, the organizer of the energetic County Fair happening July 14th to 16th. We're under a week away from the inaugural festival, so we'll talk about the hurdles they've overcome in bringing the festival to Fort St. John and just general excitement for it. It's going to be a blast. More on that in a bit. But first, the RCMP's Car 60 program is underway here in Fort St. John, where a mental health clinician will attend with an RCMP member to do mental health wellness checks in our community during weekdays. To talk more about the program and its importance, we're joined now by Northern Health's Northeast Chief Operating Officer, Angela Smit. Angela, welcome back to Moose Talks.
Thank you for having me.
You're very welcome. Thank you so much for being here today. So why don't you tell us a bit about the program, if you don't mind, to kind of get us started. How did it come about here in Fort St. John?
Yeah, so Northern Health has had a pre-existing Car 60 program in Prince George, and when the RCMP, I think the corporal moved from Prince George to Fort St. John, really that really resonated with him in terms of the benefits of the program, and so really started to work in terms of how to start up a Car 60 program. And there had been some conversations with the city prior to that with Northern Health about how we as healthcare providers can support and collaborate with the RCMP when they're responding to 911 calls related to mental health concerns, or like you said, wellness checks, where we just want to make sure that the individuals that need our assistance are getting the services they require.
Mm-hmm. So kind of before, it was more of you'd get a 911 call coming through from somebody in town. They'd say, you know, my friend's in distress or whatever it happens to be. A member would attend first from the RCMP. If it was decided they then went to the hospital, then sort of a Northern Health employee, a mental health wellness person would sort of take over from there, I suppose. Eh?
Yes, that's correct. There was occasional where they would connect up with our ICMT, our intensive case management team, but typically, yes, the RCMP responded on their own and then would bring them into hospital for services after that time.
Oh, okay. Was there you said the corporal kind of brought this idea with them. Was there an identified need for this already, that sort of everyone already kind of saw that this would be something that maybe was needed in the future anyway? And then because he brought the idea, it was like, oh, well, great, let's do this.
Yeah, so I think the idea had been there for quite some time. Yeah. Mayor Ackerman had identified what would it take in order to look at this. And then I think by the fact that the corporal did come to Fort St. John, it helped to kind of kickstart it further in terms of the importance of this and the benefit of this. So, but yes, the city had identified it through concerns that were raised by the RCMP about the amount of time that they were spending responding to these calls and feeling like they needed some additional support from content experts such as healthcare professionals.
Mm-hmm. I'm asking you off the top of your head, do you happen to know what an average time was before that you're hoping to maybe shorten by implementing this, or?
No, I don't know.
Okay.
That would be an RCMP question.
Sure.
In terms of both the volume of calls as well as the time commitment that it took to respond to these calls and then bring the individuals into hospital if that was appropriate.
Okay. One big question I had about this is I'm curious as if you can speak to how the member and the mental health clinician or worker that'll be with the RCMP member will sort of work together. Is there been talk of the members in charge of what's happening? So if they feel like the situation needs to be escalated, in that rare occurrence, then they're free to do so? Or is the mental health person there to say, maybe we don't need to do this yet, we need to get them to the hospital instead?
Yeah, I think that'll be kind of a transition. So
Yeah.
we were able to send our mental health clinician down to Prince George to do a ride along, understand how the CAR 60 program that has been working for a number of years and what those relationships are in terms of who's doing the conversation, who's doing the de-escalation, and but I'm not quite sure of the logistics in terms of how that will work out. The understanding, based on what we've seen with the CAR 60 other programs, is that it will actually reduce the number of visits to hospital because it will help to de-escalate and tap them into services, because the mental health clinician knows kind of what services are out there from a healthcare perspective that they can tap into without having to actually go to the emergency department.
I see. So it's sort of moving sort of the mental health supports that, as you said, used to be the member would take them to the hospital. They'd kind of be dealt with there in a way. Some of that anyway can happen on the scene instead then.
Yeah. Yep. Correct.
I see. Okay. Now I wonder, at the moment, as I understand it, you've got kind of one employee on this. There's going to be a second one sort of for coverage kind of issues soon. And so it's kind of only available kind of certain times of the day. And as I understand, it's kind of during the week, in the middle of the day that this can happen. Otherwise, it'll be kind of, I assume, status quo with how members respond to these sort of situations outside of those hours. Has there already been talk about how this program can maybe expand, or is there kind of, we have to wait and see how this goes first before we can start putting maybe more people on it?
Yeah, I think it's a combination. So we, Northern Health has been meeting with RCMP in terms of where may their highest volume of call be, and that has led to the decision in terms of having the Monday to Friday in terms of the individuals working together. But yes, it will be an evolution over time based on how well it's working, how many calls, do we need to expand it. We are working to get a nurse as well as part of the team to support this, but it is coming down to, as we know, the recruitment and trying to add and complement to this team. So I believe it'll just evolve over time and based on the need that we're seeing.
Mm-hmm. Now, you did mention that the clinician went down and had like a ride along and sort of had experiences to see kind of how it works in Prince George already. What else? What other additional training have they sort of had to have with members to kind of prepare for this?
Good question. I'm not sure if they've had additional training here, like in Fort St. John, because de-escalation and work with mental health clients and vulnerable population is part of this individual has come from the intense case management team, so she's worked with that team as well for quite some time. So I think largely it was in terms of how does the program work, and that was the real good experience gained by being able to go to Prince George and seeing it in action in terms of the benefits of it.
Mm-hmm. And you were saying beforehand, and I can't remember if the photos of it showed this, but the person working with them will have to wear like I don't know if it's bulletproof, but like one of the vests essentially that members wear too, correct? Because they're part of the situation.
Yes, correct. So part of it is complying with what the RCMP requirements are, and one of those is the fitted vest, and it'll clearly identify them so that they know that the individual knows when they respond that they're not an RCMP, right? So it'll clearly identify them as a clinician, so that they know that they're there to support them in a different way.
I see. Well, I mean, the program's fascinating. I can't wait to hear kind of how the rollout goes. I was hoping we could also ask you a bit about the overdose prevention services thing that was going on, where originally you maybe had somebody in mind where you could put it and kind of had that sorted out, but then the permit was withdrawn, if I remember right. Do you have any update on that process, and if Northern Health's been able to start something else somewhere else, perhaps in the near future?
Yeah, so we haven't had any further success to date. We did contract an external company to look at where other facilities or sites could be and talking to different landlords. There is one that's interested, but we're still working through the details with them. So we're really hoping to have a overdose prevention site up and functional by winter.
Okay.
We will still have the mobile van, but we know that based on the experience last winter, that it's just not ideal because of our cold weather here. But we're continuing to work with the different landlords within the kind of the Fort St. John kind of center area where it would be best used and accessible, and then create those wraparound services. So it's not just as an overdose prevention site. It'll have counselors in it where they can support them, refer them to other services. And we're still moving forward with that.
Excellent. All right, Angela. Well, I really appreciate you coming by and talking about the Car 60 program and the overdose prevention site. I appreciate your time today. Thank you so much.
.ca.
Welcome back to the show. I'm Dub Craig. Now, I'm very happy to be joined once again by the organizer of the Energetic County Fair, which is, believe it or not, less than a week away. My goodness, how exciting is that? Dale Plourde is live in studio with us now. Welcome back to Moose Talks, Dale.
Good morning.
Thanks for being
This is the second time on Moose Talks. I'm not sure what that means.
here.
Maybe you're really desperate for guests, or I might have something good to say. I don't know.
I think you have a lot of good things to say because, as I said, I mean, we're less than a week out. You must be just like vibrating with excitement at this point,
I feel pretty excited, like Christmas, and in a way, it's very exciting.
I mean, especially since we had you on. I'm blanking on the day now, but it was
March?
Yeah, and it was not too long after you had sort of announced we're going to do this. I'm going to go to. I think you had gone to the city council already and said I'd like to do this. So, in just a few short months, it's kind of happened.
It's here, yeah.
Right? How are you feeling about the amount of work you've managed to sort of get done in that time, and all the hoops you kind of had to jump through at the city?
Proud and excited, and just it's here, and ticket sales are going well, and the bands are all coming, and it's just amazing. I don't know how to explain that. We've got a great group of vendors as well, and the experience. I'm pretty excited to see people's faces when they walk through those gates.
I have to say, is this kind of the I don't want to say the worst time, but as I understand it, the sort of last hoop you had to jump through was earlier this week, and then you kind of said everything's ready. It's just sort of essentially the festival happens now. So are you in this in between time where you're like, I gotta wait now for a few days before we start building everything, and then it'll happen, and then it's kind of over?
No, actually, there's a lot that I'm doing. A lot of little things like rooming lists for artists and catering for artists and organizing all that, and I've got some great help. We've got organizing several dozen volunteers. For example, there's 80 shifts to cover throughout the festival, and
Wow.
for volunteers, and we still have a couple spots for people that want to help set up and be part of that, but no, there's no downtime. But mind you, it isn't go either.
Yeah.
So we're getting ready for go time, and everything shows up next Wednesday. Today we're putting up fencing and banners.
Okay. That was going to be my next question, is kind of when are we? Because I drive by there quite a bit where the site is, and you haven't seen anything yet. So you say the fencing will go up this weekend, and then the stage and stuff kind of arrives on Wednesday.
Midweek, yeah, and
I see.
and the tents before that, so people will start to see something come to life. And the funny thing is, we've got half the fencing up. You stand inside, and we've been a lot of people just scratching their head and saying, I just can't see it in that spot. And well, it's a huge spot. First of all, it's if you look at the space of, if you put 5 North Peace Arena ice surfaces all in one area, that's a pretty big spot. And that is the ice arena is licensed for 1,600 people. For an event, like if you want to do a beer garden in there or something. So times that by 5. It's a huge space.
Yeah, I mean, when you put it that way, definitely it's like it's bigger than it looks like, I suppose.
Yes.
Because
so as it comes together and you get the fencing up, you can now see like, okay, wow, from corner to corner, that's a whole city block, corner to corner. It's huge, right?
Absolutely. I want to talk about some of the things you had to, the hoops, as I keep putting them, that you had to jump through for the city. I think when you were here last time, you said, yeah, no problem. This is going to be no an issue. I'm prepared for this. I've done this before. I'm all that kind of stuff. Did it work out that way? Did you ever really feel, like stressed about it? Or were you like, this is going to be
definitely,
fine?
yeah. There definitely was some stressful moments when, it seemed like some of the things I like to be fair and reasonable. They just seem unreasonable and unnecessary.
Yeah.
However, the city has to make sure that it's a great event, and without an unknown entity to a lot of people, even though I have done shows like in the arena 30 years ago, a lot of those people weren't around then. So it's just like people don't know what they're going to see. It's the same as the city doesn't know what they're going to see.
Yeah.
Here's a guy that says he's going to do this great fun thing, but just got to make sure it is that, right?
Yeah.
So it's been good. We've been educating each other, and I'm kind of like the guinea pig, so to speak, because this is the first time ever that this has happened in our city. So a bit of a pioneer, but it's been stressful for me, definitely, and fun at the same time. And through those, if it was easy, everybody would be doing it, right?
Absolutely.
And the things that are a little bit more difficult are more rewarding in the end.
Absolutely. All right. Well, you've got 3 days of acts coming, Thursday, Friday, Saturday night. It's going to be a lot of fun. I wonder if you would be willing to say if there's somebody you're most excited to see and most looking forward to watching on this stage over the weekend.
I am, actually, and I don't want to be that way because the entire thing, right from the local artists, singer, songwriter, guitar and vocal, like even Braden Watson with the guitar, and there's a young lady named Megan Clarence who's going to be opening the show on Saturday. She's got a great voice, and she's just a little teenager, and the whole thing is there's so much talent here, Dub. But to answer your question, I think Thursday night with Kyle McCurney and the Washboard Union is sort of. I'm really looking forward to that show.
Yeah, I mean, we've been talking about Kyle McCurney so much on this station in the past 6 months. He's had quite a run. His new album, he's getting funding. He's getting nominated for awards and whatnot, and then now he's playing the Energetic County Fair. I think it's going to be a blast. I want to look forward now, if we can, for a second. Again, I don't know if you've had the time to do this yet, but as you said, you're sort of setting a precedent here. Next year, presumably, you're going to try to bring the festival back. How much thought of that have you already put into?
Oh, quite a bit. Yeah. Like I said, this whole thing, when I presented to the city, is a 3-year and a 10-year plan to build an annual signature festival, which involves many different things going on. Maybe the Taste of Fort St. John happens at the same time, like it did at the curling meet, but we schedule it so it all happens Energetic County Fair weekend, or something like Rib Fest as well. That all happens Energetic County Fair weekend, which we're lucky that it is actually happening, because the city's just going to be alive, and that's sort of my vision, and just keep heading in that direction and involving more groups to do things during that weekend, or those 3 days or 4 days, or hopefully it could become 7 days, or who knows, right?
Absolutely. Wonderful, Dale. All right. You mentioned quickly that you're still looking for some volunteers to fill spots. What's the best way for them if someone's listening now and say, hey, I'd love to be involved for a bit? How do they get a hold of you? What's the best way?
The energetic countyfair.ca, and then there's a tab in the menu. They just click on that, and it says volunteers. You click on that, and it opens up a short form that you fill out, and with basically your contact information and what your skill set is and what you'd like to do, and press submit, and we'll get back to you within a day or so and schedule you in.
Perfect.
And then everybody who volunteers a 4-hour shift gets a VIP pass for the entire weekend. So it's a pretty
Okay.
good deal.
I'll say, yeah, only 4 hours is like half day, right?
And that could be setting up too. So you don't actually have to be, spend 4 hours setting up next week and you're in for the whole weekend.
Perfect. All right. And then, of course, you can buy tickets online at energeticcountyfair.ca. And you could still win some tickets from us, as you very graciously gave us 101 tickets to give away. We've given almost all of them away, but we got a few left, so be listening.
How's the response been for that?
Oh, wonderful. It's been excellent so far. So we only have a few left to give away, but you'll have to be listening to hear more about that next week on how we're going to do that. Dale, thank you so much for taking a few minutes out of your busy schedule.
Thank you for all the
to talk to
support
us.
and kindness and support, mostly. Yeah, it's great.
Absolutely. It's Dale Plourde with the Energetic County Fair here
On in the